Welcome back. You're listening to the panel discussion, Transforming the Citizen's Digital Experience in Government, sponsored by KPMG on Federal News Radio, part of the Federal News Network. I'm your host, Jason Miller. My guests today, Barbara Morton, the Deputy Chief Veterans Experience Officer with the Department of Veterans Affairs, Lori Ruderman, the initiative lead of the Reimagined Buy Smarter initiative at the Department of Health and Human Services, Guy Kiyokawa, the Deputy Director of the Defense Health Agency, and Quimby Kaiser, a Federal Advisory Principal at KPMG. Before break, we were talking a lot about the technology and not the goal of not chasing the technology, really looking at the business. One big piece of that also is understanding what success looks like. So Guy, maybe start off with, you guys are bringing together such a large amount of people and services. How do you measure success?
So I mentioned a little while ago about our transition measures to make sure things don't break, but we didn't just make those up. Those were actually coming from our overall enterprise system performance, and we have something called a quad aim. So as I mentioned, our focus is on readiness of the force, but also health, better care, and lower costs. That's our quad aim. So then we break down to specific measures, and the way we developed those measures was, unfortunately, as you bring a group together, you kind of tend to get to agreement. And
you hope at least, right?
Well, unfortunately, the agreement piece becomes your driving criteria, right? So then you start to ask the question, do you have the optimum measure in this case, or is it just one we could agree to? So I would say if you're in that situation, it's not bad to get to that agreement, but then you gotta have a process that continues to move that measure. What we found is we started to measure more process as opposed to outcomes. And so the real key is, how do you take that as a starting point and then get to true outcomes? And in our case with hospitals, how can the hospitals then focus on those outcome measures, do the necessary changes in their day-to-day operations, and in our case it would be in performance improvement, and then change those measures. But more importantly, if you've come up with a better way to do it, then how does that flow up through the system so that we can spread it across the enterprise? So that's kind of the concept. I would say giving a kudos, I'm an Army guy, so I got to give kudos to the Navy. Navy Medicine actually did a really good job with that bottoms-up approach, and we saw the dials move. We've taken that approach to the enterprise, and that's what we're kind of looking at to kind of operationalize the results of some of those measures.
And a measure could be something as simple as someone's walking out the door, do they press the happy face, the smiley, the unhappy face? And it could be something more complicated, as in the time spent with patient, or again, we're looking at the outcome, not the process, which was, did we process that piece of paper in 12 minutes or less?
Right, and so as I mentioned before, timeliness to getting an appointment, right? There are multiple measures in that lane. On the health side, we're trying to dive into the space industry has dove into, like Leapfrog, which is kind of comparing hospitals in a geographic area based on some of their quality patient safety measures, and really looking just like the way we look at Yelp or Amazon, with star ratings, and being able to just make it very simple. And if you want to dig into the details, you're able to dig into the details.
It's interesting you brought up Yelp or star ratings. People hate that sometimes, right? But at the same time, it's we all use it. I can tell you that when I'm in a different city or different part of the Virginia or something, and I'm looking at Yelp for restaurant reviews. Barbara, are you guys using, what are your success metrics?
No, so great question. So I think there's a constellation of performance metrics and data, I think, in any government organization, and all are important, but I think some have had more visibility than others. So in the Department of Veterans Affairs, historically, there's been a lot of focus on the operational metrics, meaning how many cases have you adjudicated, how many hearings have you held, how many appointments have you scheduled. Those are very, very important, but we also have to include in the balanced scorecard, of course, the experience metrics. And so the way we do that is, of course, we always start with the journey map, human-centered design. We understand what the customer's journey is with VA and understand the moments that matter most to them, right? And then we measure ourselves, our performance, against those moments that matter most to them. So as an example, in the healthcare space, working with the Veterans Health Administration, again, early adopter, great partner with us, we mapped out the patient experience for outpatient services and those moments that matter, and then we mapped them against trust, overall trust. Was it easy to have that transaction? Was it effective? And did you feel emotionally like it was an emotionally resonant experience and a valued customer? And the Health Administration actually performs quite well in all of those domains, high 80s, low 90s, which is wonderful news. But we know that we're measuring the right things because we're measuring the things that matter most to our customers.
Quimby, are you seeing a movement within either, again, the federal agencies or the private sector around kind of that measurement of success? Is it getting away from process and more towards outputs?
I think you have to have both. I think that people drown in data. I mean, if you think about it, you're trying to understand your customer, you're getting data, you're measuring your operations, you're getting data. I think there's a movement to simplify and really come down to the things that are important for the customer. Yes. I think the moments that matter, Barbara, that you brought up are key, is understanding what really matters. Because we can measure a lot of things that actually really don't matter, whether it's an input, a process, or an output. And I would always say the outcome measures are the most critical because you want your inputs in your process to then correlate to your ability to achieve those outcomes consistently well. I would say that what we're seeing is as we learn, people are simplifying and getting more pragmatic about what can we really absorb, what can we really communicate to people. I think, Guy, what you were explaining is if the people in the front line don't understand what you're measuring, it's almost impossible to move the needle.
I think that's a great piece of on moving the needle. Where can you have an effect? And Lori, maybe talk a little bit about your success metrics, but also that piece of you don't want to get stuck in that data and be overwhelmed.
Well, I think one of the things we struggle with is our leadership wants us to measure cost savings, cost avoidance. That's what the taxpayers want, but we don't want care to suffer. We touch people when they're sick, when they're hurt, when they're scared. We need to make sure that our mission comes first. And if we can drive cost savings and cost avoidance, we can revert money back to the mission. So we measure the cost savings, and we're projecting a $720 million a year cost savings once we're fully implemented. But that's only going to tell us that the users are adopting what we're doing, that they're happy with what we've built, and that they're happy with the way it's working. If we don't build it well, they're not going to come, and we won't see the cost savings. So I hate to tout cost savings as our primary metric, but it really does show us if we're doing things the right way.
And Guy, in the same vein, cost savings is big for the Defense Health Agency as you guys are merging these hospitals, but it's a factor, but not the driving factor. Right. How do you kind of balance that over pragmatic approach to collecting the right data for the right metrics to make the right decisions?
Right. So how we nest, because remember, we're not the Defense Health Agency as an agency in the federal government. We're part of the Department of Defense. And so the Secretary of Defense has three main objectives: increasing lethality, strengthening partnerships and alliances, and reform. Interestingly enough, we're at the heart of that reform piece. And as was mentioned, it's not a driving factor, but because of the way we run finances in the federal government, it is a piece that you can get to is, for our case, in reform to actually show how that then translates into increased lethality for the Department of Defense. So how do we do that within our space? Well, it's back to some of those metrics again. And, in the federal government, we kind of have kind of a quirky way of running finances because we have fiscal years. And so what we're trying to do right now is, besides those measures then, is looking at these enterprise initiatives. Because remember, where we started is the Army, Navy, and Air Force each did a function on their own a different way. So how do we do it across the enterprise, keeping sure we're staying with those outcome measures, but then gaining some of those efficiencies that sometimes is not just technology, but as I was saying before with requirements, is sometimes aggregating demand signals. And I think we are finding that's where we're getting the biggest savings. For example, in a geographic market, if you have multiple hospitals and they're each cutting a task order against a contract for healthcare providers, we have already aggregated the contract, but there's some savings. The real savings is, okay, don't have 5 different task orders for 5 doctors, have 1 task order for 5 doctors, and then you can get a better price out of it. And that's what we're trying to go after right now.
And Barbara, jump in here too, because VA has a big budget. You guys keep getting more money, but your job gets bigger and bigger as well. Yep. So while cost savings is one metric, it's also the data toward the decision making is what's really key. So the pragmatic approach to both the data driving decisions, but also driving cost savings.
Yeah, absolutely. I mean, I think, I'm a taxpayer. We're all taxpayers, so I'm very conscientious of that role as a steward. And so certainly want to always find efficiencies in terms of what we're doing. And for me, I'm a very practical person. I do believe that when you start with the customer first and design around the customer, ultimately you're going to get a better product and result for them, which is ultimately going to save time, energy, money, and resources. So I think, one of the things that I'm grateful for is that our current secretary and leadership has been willing and wanting to invest in the capability of customer experience that customer experience can bring. So going forward, we can provide better experiences and realize those efficiencies and cost savings as well.
Quimby?
I was just going to say, I mean, if you go to Forrester's research on customer experience, the data shows over and over again, if government organizations focus on customer experience and look to improve the customer experience against those dimensions, you'll get better, you'll get people looking to get information from the organization, you'll have better adherence to the things that you need to have happen. Good things happen when people focus on customer experience as a way to focus initiatives and think about your effectiveness with the constituents you have.
We're almost out of time, but before I let everyone go, there's one other piece to this that hasn't really come up much during this conversation, but I think it's very important. As you have these high-touch systems, as you are reaching out to people, whether, again, through contact centers, through websites, through texting, through mobile communications, chats, there is a cybersecurity component to this. And I think the balancing of cybersecurity with accessibility is something that I think agencies and organizations have always struggled with. Guy, maybe you start us off on this one too. How are you finding that balance?
Right. So one of the key things in the Department of Defense, obviously, security is everything, whether it be physical or now with the cyberspace, and it's evolving, right? Just when you think you had the standard changes. So the real question is, how can you be agile, not only on the cyber side, but to your point, how do you balance that with your operations? So for us, with our new electronic health record, it's meant to be interactive with the patient and the customer, which means you got to have those portals to the public, which scares the daylights out of the cyber guys, because now you're exposing the data, which, protected health information is not just about your personal information, but the threat of using that data against people as an actual weapon. So we're trying to balance that, as I mentioned before, by bringing together the IT infrastructure and literally having our own medical IT infrastructure that has connection to the DoD, but they just as well have us operate separately from a security standpoint. We still have to apply all the same security standards, but we're now in a more cordoned off space so that we can have those interfaces with the public and also with our friends in the VA, which quite frankly, I'm a veteran, so I interact both with the military health system and the veteran system, and my expectation is it's all connected. Even though I know it's not yet, my expectation is that it's going to be all connected.
And I know VA is going down the path of identity management, credential access management, ID.me is an example. Maybe talk a little bit about how you're finding that balance.
Yeah, I mean, I think, it's interesting. I mean, trust is really our goal, is to earn and to maintain trust in all the veterans and family members, caregivers, survivors that we serve. Cybersecurity, of course, is a delicate issue for us because, there's nothing more important than protecting PII because that drives a lot of trust that our customers have in us. So I think this is a perfect example of how government has to navigate things in slightly a different way maybe than industry does. Certainly industry has to protect privacy as well, but because we are stewards of personal information and taxpayer dollars, there's just a higher standard for us. So that balance definitely can be tricky. I think it's definitely achievable. And with respect to the electronic health record, one of the things that we're trying to do is work closely with that team to make sure we can bring that voice of the customer while they're co-designing the solutions that'll be rolling out. And I love what you mentioned, Guy, about, from your perspective as a customer, you expect those systems from DoD to VA to be integrated. And that's exactly what the experience we're trying to achieve while preserving privacy.
And Lori, jump in here real quick, because you also have, on the emerging technology side, then that adds another layer of complexity.
Well, actually, that provides a unique challenge for Health and Human Services. Our former Director of Acquisitions is now our Chief Information Officer, and in his former role, he established a brand new technology infrastructure for the department, and now that Jose Arrieta is our Chief Information Officer, he's opening doors to these new and innovative technologies in ways the department has never seen before. But our infrastructure, our security infrastructure, is designed for that old legacy system model. Authorizations to operate can take a year, 18 months, and by then our technology is outdated. So we're going to have to develop new infrastructure to make sure that we're secure, but that we're meeting the speed requirements that are coming forth with the newer technologies.
Well, on that note, unfortunately, that's all the time we have for today. This is a great conversation. I really appreciate everyone's time. You've been listening to the panel discussion, Transforming the Citizen's Digital Experience in Government, sponsored by KPMG on Federal News Radio, part of the Federal News Network. Let me thank my guests. Barbara Morton, the Deputy Chief Veterans Experience Officer with the Department of Veterans Affairs. Lori Ruderman, the initiative lead of the Reimagined Buy Smarter initiative at the Department of Health and Human Services. Guy Kiyokawa, the Deputy Director of the Defense Health Agency. And Quimby Kaiser, a Federal Advisory Principal at KPMG. For more on this discussion, visit federalnewsnetwork.com and search KPMG.